Thank you for joining our on-demand REDFEB webinar. My name is Julianne Mitchell and I'm delighted you can join us as we delve into simple but powerful ideas on how we can enhance our heart and brain health. Together we'll explore how prioritising your heart health is not only good for your heart but also supports cognitive function and thinking abilities as we age. At Heart Research Australia, we emphasise the 4 M's: meals, movement, measurement, and mental wellness. It's an easy to follow framework that guides healthier living and helps prevent heart disease and the risk of cognitive decline as we age. Together we'll be joined by some outstanding experts who will unpack in clear and practical ways the strategies we all need to adopt to remain heart and brain healthy. These experts include Cardiologist Dr Edward Barin, Clinical Neuropsychologist Dr Miranda, Nutrition Expert Miss Chloe Steele, and Exercise Physiologist Danisha Arawira. Together we'll cover practical, science-backed information, tips and tricks that will help us all live longer, healthier and more active lives. So to speak to us today, our first heart health expert is Dr Edward Barin. Welcome, Dr Barin. It's an absolute pleasure to have you here.
It's a pleasure to be here. Thank you very much for having me.
Eddie, you're familiar with the 4 M's approach. Could you briefly explain what they are?
Sure. The 4 M's framework serves as a practical blueprint for living a healthier life, focusing on meals, movement, measurement, and mental wellness. It's designed to address risk factors we can control through simple everyday actions that significantly impact our future health, particularly heart and vascular health. There's more detailed information on the Heart Research Australia website, along with tips and strategies from relevant experts in the field. But regarding meals, focus on eating mindfully and intelligently, embracing balance and moderation in your diet. Regarding movement, stay active at every age and maintain a good level of fitness. Movement and strength are key to maintaining health overall. Regarding measurement, keep track of important health metrics such as cholesterol, blood pressure, blood sugar levels, waist circumference, and weight. Regarding mental wellness, prioritize a positive mindset and nurture meaningful connections. A positive social connection is crucial for everyone, particularly as we age. Additionally, practicing mindfulness, managing stress, and engaging in activities that challenge and stimulate your brain all play an essential part in maintaining mental and cognitive health.
So we know that things like high blood pressure and high cholesterol affect the blood vessels of the heart, but is it correct that they are also found to affect the blood flow to the brain?
Yes, that's correct. High blood pressure and high cholesterol don't just impact the blood vessels of the heart, they affect the blood vessels supplying all major organs, including the brain. When blood vessels become narrowed or blocked by plaque building up on the inside, it reduces blood flow, depriving cells of essential nutrients and oxygen. In the brain, it leads to cognitive and thinking difficulties over time and is a contributing factor in the development of dementia.
So, look, it is surprising to hear, it's new knowledge really, that risk factors for heart disease are also risk factors for brain conditions. Can you explain more about how common dementia is and why it's a growing concern?
dementia has become a significant health concern, now ranking as the second leading cause of death in Australia, particularly in women. Currently, more than 421,000 Australians are living with dementia in 2024, and the number is expected to climb and double by 2054. And this highlights the importance and urgent need for prevention, research, and understanding of this process for this growing challenge.
So you mentioned before measurement as part of the 4 M's. Can you explain to me what I need to do to know my numbers?
Look, the first step in the measurement aspect of 4 M's is to establish a baseline. Visit the doctor, your GP, to assess the health metrics such as blood pressure, cholesterol, sugar levels, waist circumference, and weight. And these numbers provide essential insights into the overall health and can guide lifestyle adjustments to address specific areas of concerns. For example, if your weight is within the healthy range, but your blood pressure is elevated, that directs you to where you should focus your efforts on improving that aspect of your health. If your weight is normal, but you feel breathless after just a few minutes of exercise, it could signal a need to increase your activity levels and therefore explore the potential of respiratory or cardiovascular issues with your doctor. By tracking these measurements regularly, you can take proactive steps to maintain and improve your health. Be on top of any abnormalities that occur, and on the flip side, see positive improvements that then motivate you to new lifestyle changes that you may want to make.
So unmanaged high cholesterol and high blood pressure, as you've explained, not only affects heart health, but also brain health. Are there any telltale symptoms of either of those conditions?
Unfortunately, no. High cholesterol and high blood pressure are often referred to as silent conditions because they typically don't present any noticeable symptoms. And this is why regular monitoring is important. Without routine checkups, these issues can go undetected and progress, and they can lead to serious health implications.
So Eddie, at what age do you think it's important for us to really start focusing on our overall heart health?
It's never too late to start, but clearly the earlier the better. Developing a good series of habits early in life lays the foundation for long-term heart health. And even small changes later on can still make a significant difference.
Our understanding of heart disease, diagnosis, treatment, management is changing rapidly. What is it that excites you most about the discoveries we're making today?
The advancements we're seeing today in technology and genetics are transforming our understanding of cardiovascular disease across the spectrum, offering diagnostic and treatment options far beyond what was possible in the 20th century, which is exciting. While we've already made significant progress in surgical techniques and understanding the body's mechanisms, we're now entering an exciting new era of things like AI and so many other new developments that could revolutionize how we prevent, diagnose, and ultimately treat heart disease and brain disease. And this is why continued investment in research is so critical. It fuels these innovations and bring us closer to a future where heart disease is more manageable and preventable than ever before.
Well, Eddie, it's been wonderful to have you here to give a full explanation of the 4 M's and their relevance to not only heart, but also brain health. We really value your time, and it has been a pleasure.
Thank you very much.
It's now my pleasure to introduce Dr. Miranda, clinical neuropsychologist, who will speak in more detail about why heart health is important to brain health and vice versa. So Miranda, welcome.
Thank you. Thank you so much for having me.
We've just spoken with Dr. Eddie Barin about the 4 M's and the importance of making simple lifestyle changes now that can improve our future heart health. Why is keeping our heart healthy so important to the brain?
It's an excellent question. I think people very much understand the importance of looking after the heart and the brain for their health. Clearly, they're very central to our well-being. But people don't always understand quite how intimately the 2 organs are connected. So obviously the heart's role is to pump blood, and it pumps blood to the whole body, including the brain. What I find really interesting is the brain weighs about 2% of our full body weight, but it uses around 20% of the body's blood. So it's a very thirsty organ. And what's important to understand is that the brain requires a constant flow of blood essentially for its survival. Now, the cells within the brain are called neurons. There's more than 80 billion neurons in a brain. It's crazy. And the brain cells are reliant on blood for a number of different purposes, partly to get oxygen and nutrients, but also the blood helps to remove some of the so-called waste from the cells. And what's also important to understand, if a brain cell is deprived of blood for a certain amount of time, you see either dysfunction or ultimately death of that brain cell. So if you think of how important our brain is in terms of our cognition, memory, movement, personality, the list goes on, you can understand how it's really important to make sure the heart is functioning well to optimise our brain health.
So Dr. Barin spoke of the importance of knowing your numbers, particularly blood pressure and cholesterol. Can these conditions also impact the brain?
Yeah, absolutely. I think it's helpful to step back a little bit and understand how blood pressure and cholesterol can impact the blood vessels, because that's a common factor in both brain and heart health. So the blood vessels, or the arteries that carry blood to the organs, can both be impacted by blood pressure and cholesterol when they are poorly managed, so too high. Now, the cholesterol, if it's too high, you can get the accumulation of what are these sort of fatty deposits or plaques around the blood vessel wall, the inside. And blood pressure, when it's high, can put unhealthy pressure on the blood vessel. And both of these processes can contribute to this thing called atherosclerosis. And what this means is the blood vessel becomes more narrow and also hardened. And when it's more narrow and hardened, it can restrict the amount of blood that's flowing, and in really bad cases can completely block blood flow. So if that's occurring in the artery that's going to your heart, you can get things such as angina or heart attacks. And likewise, you can have the same process occur in the blood vessels that take blood from the heart to the brain. And when that's the case, and you're getting restricted, or even worse, a lack of blood flow to different parts of the brain, that's where you can see ultimately cell death. Now, this can be very, very small, or if it's a larger vessel, it can be a larger area, so a lot of brain cells are dying, and this is what we'd call a stroke. And obviously it depends on the area or the size of the stroke, what effect it's going to have, but that's very likely to have some impact on your thinking and your memory. And it's worthwhile mentioning as an aside that high levels of cholesterol and high blood pressure are also in general associated with a higher chance of developing dementia in later life. So it's quite a lot of connection there between heart health and brain health.
Yeah, clearly. Mental wellness makes up one of the 4 M's. The focus of this framework is not only on ways to reduce risk, but also actions you can take to improve function. Can you explain more about this in relation to brain health?
Yes, certainly. So when we think of the health of the brain or the heart or other organs, I like to think of factors that are fixed, so things such as your age, genetics. We can't do anything to change them, obviously.
Yeah.
But then there are also what we call modifiable factors, and that's where the 4 M's really comes in. And something I love about the 4 M's, it's all about small achievable steps. So in terms of mental wellness, maybe we can focus on blood pressure as an example. So I mentioned earlier that raised blood pressure can increase your chance of developing dementia later in life. There's research data that suggests or will show an association between raised blood pressure in the middle years of life, so say your 40s, your 50s, and the onset of dementia, an increased chance of getting dementia in later life. So this message is not just for people in the later age of life. This is really a message that's relevant for everyone. So what's interesting about midlife is I see patients in my clinical practice who are in this age range, and I'm sure people watching today can probably relate to this, either themselves or someone they know. There are so many things for people at this age to juggle, whether it's young kids, aging parents, a demanding job, bills, mortgage, so many commitments. And life is hectic. A lot of my patients wake up in the morning and until they're back in bed, it's go, 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 multitasking, juggling too many balls. And interestingly, a lot of patients in this situation might say, I'm not stressed, I don't feel stressed. But what's essentially happening is they're so used to being stressed that they're essentially numb to their bodily symptoms of stress. Now, the danger of this is when we see a stressor, when the brain perceives stress, it triggers the release of certain hormones in the body to respond, one of which is cortisol. I'm sure people have heard of the fight or flight response. And that's a really healthy response if there's an immediate threat. The problem is if we are go, go, go and have raised levels of cortisol and blood pressure, because raised blood pressure is part of that response as well, people are essentially spending the whole day in a heightened state without returning back to baseline. And for these patients, I explain to them that raised cortisol and raised blood pressure are both associated with a risk in the chance of having a stroke and having heart disease. So that's the bad news in essence, and we can't always change our situation. We can't suddenly get rid of all our commitments, but there is a practical, easy, manageable thing that we can incorporate into our everyday lives, and that's mindfulness meditation. Now, some people think when I say that, they assume I mean running off to a mountain and sitting in silence for a month, and it's the far extreme from that. Even a short break of a couple of minutes in your day, a few times a day, to sit, slow down your breath, engage your senses, and consciously relax your muscles. Even that, just a couple of times a day, has got evidence, there's evidence in the research to show that that can reduce your blood pressure. It can bring your cortisol levels down. So I encourage my patients to build those mindful moments into their day. It can be anywhere, it can be at home, it can be in the office, it can be wherever you are.
Fantastic. So what advice would you have for people who maybe are past the hectic middle years of life but are still keen to keep their minds sharp?
Yeah, that's an excellent question, and certainly one that comes up a lot with my patients in that stage of life. So funnily enough, I actually give a similar answer. So mindfulness and meditation, as much as they can bring down blood pressure, there's a good evidence base to show that engaging in this regularly can promote what's known as neuroplasticity, which I'm sure some people have heard of. And that's the capacity for the brain to grow new brain cells and form new connections between the brain cells until the day we die. So engaging in mindfulness regularly can promote this, in particular in a region called the hippocampus, which is very central to learning and memory, which must be of interest to people from that older age bracket. And generally I'd say this comes under the umbrella of what I refer to as neuronourishment. It's super important when we're thinking about neuroplasticity for patients or people who don't have a lot built into their life to make a conscious effort. I say even just aim for one session of neuronourishment per day. What do I mean by that? It's doing something that's slightly out of your comfort zone, out of your norm, that challenges you, and just a little bit of a workout for your brain. But the holy grail is when you can choose something that is meaningful, make it fun, something that sparks a bit of passion and joy. That's going to be great for your brain, great for your heart, and great for your overall well-being.
Great. So if I do Wordle every day, is that a little nourishment that I should?
That's certainly a nourishment, but just keep in mind to keep it varied. So Wordle one day and maybe water aerobics the next, for example.
Great idea. Well, look, Miranda, this topic is endlessly fascinating, and there's so much I'd like to talk to you about further, which in further sessions we will. But in the meantime, thank you so much for sharing your thoughts today.
Oh, thank you for having me. It's a topic I'm so passionate about, so thank you.
We'll now turn our attention to the meals aspect of the 4 M's. And to talk to us more about this, it's my pleasure to introduce Heart Health Club nutritionist Chloe Steele.
Thank you so much for having me.
Oh, it's a pleasure. Now, Chloe, what is the ideal diet for maintaining better heart and brain health?
Okay, well, there's probably not a simple answer to this, because it's really important to remember that we're all individuals with our own individual requirements. But there are some general dietary rules that we can follow to maintain heart and brain health. There is a wealth of research to support the adoption of the Mediterranean diet, and this is a diet that follows some really basic principles that we can easily follow at home. Now, it entails eating high amounts of vegetables, fruits, seafoods, lean meats, whole grains, basically following a whole grain diet, and with the addition of olive oil in there as well. But most importantly, it limits the consumption of ultra-processed foods and sugary desserts and drinks, carbonated beverages. So diets high in ultra-processed foods can actually increase your risk for heart disease and dementia, so it's really important to limit them.
Right. So you mentioned processed foods. Can you explain a bit more about the difference between processed and ultra-processed foods?
Yeah, sure. So processed foods refers to foods that have undergone some sort of change before we see it in the supermarkets, before we can buy it as customers. Now, a lot of our food has undergone some sort of change in order for it to be sold, but not all processed food is bad for us. Some processing methods can actually help to retain the nutrients in the foods. So, for example, canned chopped tomatoes, frozen vegetables, and Greek yogurt are all great examples of healthy processed foods. Now, we would probably say that these are minimally processed foods. In contrast, ultra-processed foods have undergone extensive changes from their original forms. Now, they usually contain preservatives, colourings, and flavourings to make them more palatable, because all of those things have been stripped out of them when they've been processed. And they may also contain added sugars, salts, and fats, all of which can be detrimental to heart and brain health.
Right. Well, could you expand a bit more on that? Why are ultra-processed foods harmful to health?
Okay, well, research has shown that diets high in ultra-processed foods can actually increase your risk for heart disease and dementia. There's many reasons why, so I'll just go through a couple. They contain hidden ingredients such as sugar, fat, and salt, meaning that we can be unaware of how much of these we are eating day to day. And interestingly, although we don't think of sugar as being related to cholesterol levels, diets high in sugar have been shown to increase LDL cholesterol and decrease HDL cholesterol, which are both risk factors for heart disease. Now, high salt intake has been associated with increased blood pressure, which is another risk factor for heart disease. Now, as a result, most people would think that low sugar and low fat alternatives would be better for them. But interestingly, these can actually be just as detrimental to health as their full fat and full sugar alternatives. Now, low sugar products usually contain artificial sweeteners, which can disrupt the gut microbiota, controlling the production of the hormones that help us to feel full. Now, this can cause us to overeat and gain weight, which again is another risk factor for heart disease. Sweeteners, in contrast, have also been shown to have a similar effect to sugar on the insulin response, which may result in people who think they are eating a healthier alternative being just as susceptible to insulin resistance, which is a huge risk factor for heart disease and dementia. Low-fat alternatives usually have added sugars to enhance their taste and have had fat-soluble vitamins like vitamin D removed, both of which can be detrimental to heart and brain health. So wherever possible, I would always recommend choosing full fat and full sugar alternatives, but just limit your intake of them.
Right. Okay, well, do you have any tips and tricks when we're in the supermarket looking at cans or processed food in terms of reading the nutritional label?
Yes, I do. I've actually written an article about this on the Heart Research Australia website, so go on and have a look there. But I will give you a quick outline of what to do. Now, when you're shopping, it's essential to look at the back of any packet foods that you buy to know what you are eating. Identifying ultra-processed foods, if you do this, is really easy, especially if you read the ingredients lists. Any foods that have an extensive ingredient list, you know, loads and loads of ingredients, and contain any ingredients that you don't recognise, that have got really long names, they're not identifiable as food, will be ultra-processed. On the back of packets, items are listed in content order, going from highest to lowest in the ingredients list. So anything that features high up, so salt, sugar and fat, should be avoided if they're high up in those lists. And this also goes for foods that contain ingredients with long, complex names. I would just avoid them.
Right, good tip. Okay, so as we age, is there particular foods or types of diets that we should pay more attention to?
Yeah, absolutely. As we age, unfortunately, our muscles begin to deteriorate. And this is usually what's responsible for falls, but can also cause weight gain. Muscle is much more energetically active than fat. So we need to maintain our lean muscle to ensure that we don't put on weight, because as we know, this can be a risk factor for heart disease and dementia. In order to do this, protein is essential for building muscle, and as we age, our requirement for protein increases because of the subsequent muscle loss. Eating protein can be hard for some people because with aging comes appetite loss, and protein is really one of those nutrients that makes us feel full. So what I would suggest is that people really focus on the fact that protein is essential for healthy aging, and so subsequently, hopefully, maintain adequate levels when we're planning our meals.
Great. Well, Chloe, food is a topic that we're all interested in, but what you've given us today is really added insight into why good food is not only good for good heart, but also good brain health. So thank you for sharing your tips with us.
Oh, it's an absolute pleasure, Julianne. Thanks so much for having me.
We now come to the fourth of the 4 M's, movement. And to talk to us about this, I'd like to introduce exercise physiologist from Keyser, Denisha Eddy-Rivera. So welcome, Denisha.
Thank you for having me.
Let's start with you explaining to us why exercise is an important part of keeping healthy.
Sure. Exercise is one of the most effective ways to enhance and sustain our quality of life. It plays a vital role in managing and reducing the risk of chronic health conditions such as cardiovascular disease, type 2 diabetes and osteoporosis. Regular exercise helps preserve our strength and our cardiovascular fitness and enable us to stay active and independent as we age. Additionally, the endorphins that are released during exercise helps to boost our mental health, improve our sleep quality, and also contributes to an overall sense of wellness and well-being.
Great. And so does exercise have any effect on lowering cholesterol or blood pressure or indeed managing stress?
Yeah, absolutely. I mean, it has a really strong effect on both these things, and it's probably one of the best non-pharmacological methods of managing cardiac risk factors like high blood pressure and high cholesterol. Exercise has been shown to help reduce these factors in a kind of a cardiac-specific exercise program. It helps by improving the heart's ability to essentially pump blood and becoming more efficient, and enhancing the blood vessels' ability to expand, helping them regulate blood pressure over time. What's even better is that these benefits persist long after we've stopped exercising and offer us a sustainable way to support our heart health without relying on medication. exercise is also highly effective in managing cholesterol levels, reducing our LDL, or our bad cholesterol, whilst also simultaneously increasing our HDL, our good cholesterol. Research shows that regular physical activity encourages our muscles to use saturated fats for energy and promotes the removal of our bad cholesterol, our LDL, through the liver. Elevated HDL levels also further provide an anti-inflammatory effect and can help prevent the arterial plaque buildup in the long term. As a result, this reduces our risk of cardiac events.
Great. So look, I often hear that we should increase our strength-based training as we age. Why is that?
Strength training is super important, and probably more important as we get older. It becomes increasingly important when we find out that only 6% of the population over 65 in Australia do any form of resistance training at all.
Wow.
It's crazy. Without it, we can lose between 1 and 4% of our strength each year after the age of 65, potentially leaving us about 40% weaker within a decade. This loss also then impacts our balance, our bone density, and the ability to perform our activities of daily living. That increased risk of fall also then can result in a limitation of our independence. But by incorporating resistance training, we can maintain our strength and reduce that falls risk, stay active, so that way we can keep up with the grandchildren and enjoy life to the fullest. Stronger muscles also help support our heart health, as they require less effort from the heart to perform these daily tasks. When combined with an aerobic program, the benefits are even greater. Strength and cardio together enhances our heart function, improves our oxygen utilisation, and boosts our overall fitness, offering us a really powerful way to improve our quality of life, as well as our cardiac and brain health.
Great. Well, you certainly make an argument there. What are some examples of strength training, and is it something we can do in our homes, or do we need to go to a gym to do that?
It really depends on what you like, but it can take many forms, from using weight machines and free weights like dumbbells to resistance bands or even body weight. The key is to progressively challenge your muscles to build strength and increase our muscle mass, which is crucial for maintaining our quality of life and reducing our risks of falls and frailty. Whether at home or at a gym, it's about finding out what works best for you and works within your day-to-day activities, but a gym might offer you more options for progression.
Okay, so in general, what's the rule of thumb about how often we should exercise?
Generally, we aim to be as active every day as we can, but 150 minutes of moderate exercise a week is what's kind of recommended. That equates out to being about 20 minutes daily or 30 minutes 5 out of 7 days. On top of that, we want to do at least 2 strength training sessions a week at that moderate intensity. If we're trying to gauge what moderate intensity is, we might use a thing called the talk test. The talk test essentially tells us how hard we're working. If we can exercise and maintain a conversation but not quite sing, that would be considered moderate.
All right, I'll remember that next time I'm walking with my friends. So look, Denisha, thank you so much for giving us some insight into the importance of movement, particularly not only for heart health but also for brain health. And I think you've inspired us all to get out there and get active.
I'm glad, but thank you so much for having me. It's a really important conversation.
And indeed, I'd like to thank all our speakers today. I think they've explained in very clear detail what the connection is between brain health and heart health, but more importantly, have given us tips and tricks on how we can all lead a healthy life and make that investment in protecting our future health. Thank you so much for watching.